Gravi Health, your pregnancy support.
Hello dear. Today we will be discussing an interesting topic called constipation and hemorrhoids or piles. We will discuss the underlying causes, what you may do if you have one, and how to prevent them. So we will start with a scenario for you to understand the topic. Hadiza is a 37-year-old pregnant woman who works at a bakery. She enjoys baking and eating pastries. Prior to her pregnancy, she used to have difficulty passing stool and was constipated. Last week, she noticed blood in her stool. She was so worried that she went to the hospital where she met with a doctor who told her what to do. Now, constipation is a common condition where one may have less than 3 episodes of emptying the bowel in a week. In such condition, the stools are usually hard, dry, or lumpy. It is usually associated with difficulty or pain in passing feces. People with this condition have a feeling that not all the stool have been passed even after spending so much time and straining in the bathroom. It is a common condition in pregnancy. On the other hand, hemorrhoids, also known as piles, is the swelling of the veins around the anus. The swelling of the vein in this area can lead to bleeding if too much pressure is exerted when trying to defecate. Thus, in people who are constipated and strain to defecate, they may eventually develop hemorrhoids. A lot of people have hemorrhoids but do not know because they are not bleeding from the anus. So they only go to the hospital when they see blood in their tissue or in the closet. The amount of blood that oozes is usually small but discomforting. However, large amounts of blood can ooze in very severe cases. Thus, it is important that you talk to your doctor if you are constipated or have blood in your stool. How do you know you may be constipated? Difficulty and excessive straining when defecating. When you have less than 3 stools in a week. When your stools are frequently hard, dry, and lumpy. When you spend too much time in the toilet trying to defecate and still feel like you have not emptied your bowel despite the strength and time you spent in the bathroom. When there is blood in your feces or on tissue after wiping your buttocks. The most common danger of constipation is hemorrhoids. Some of the causes of hemorrhoids are progesterone. This is a pregnancy hormone that reduces bowel movements and may lead to constipation. Oily foods are also known to delay bowel movements and worsen constipation. Lack of exercise can lead to constipation, as exercise stimulates bowel movements. Food without fiber such as sausages, carbonated drinks, cakes can lead to constipation, which complicates the hemorrhoids. What do you do if you feel constipated? 1. You have to ensure you reduce the amount of processed and carbonated food intake, such as cakes, donuts, soft drinks, pastries, etc. You have to increase the quantity of foods with high fiber content, such as semolina, oats, sweet corn, yam, vegetables, and fruits. You have to take plenty water, at least 3 liters every day. That is 6 sachets of water or 5 bottles of water. Do not strain too much when you're defecating. And also, temporarily avoid oily or spicy foods. Exercise moderately, such as walking, dancing, or sit-ups. If you notice there is blood in your stool or on the tissue, do the following. Use a cloth soaked in ice or very cold water to ease the pain. Hold it gently against the piles, as adding too much pressure may worsen the bleeding. If the piles stick out, push them back gently using a lubricating jelly or oil. Avoid straining to pass stool, as this can make your piles worse. And after passing stool, clean your anus with moist toilet paper or use baby wipes instead of dry toilet paper. After passing stool, make sure you clean your anus very well, as failure to clean it will make the area worse and spread infection all around your body. In conclusion, it is important that you consume high fiber diets, fruits and vegetables. Avoid straining. Your doctor may prescribe medication for constipation, but make sure you consult your doctor before taking any medication, as it may not be safe in pregnancy. Call to action. Have you eaten the fruits today? As they say, an apple a day keeps the doctor away.
For more antenatal videos, tips, tools, and professional help, kindly visit our website at www.gravihealth.com or visit our social media handles on Instagram, Facebook, Twitter, and YouTube at GraviHealth. GraviHealth, your pregnancy support.